The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. I'm excited for today's episode. Excited for our guests to share. As you know, I love it when we have dentists that come on the program and share with other dentists. It's just a great community. Grateful to be a part of it and grateful again for our guests. Without any further ado, Ilona Casellini, say hello to everyone.
Hi, nice to see you. Thank you for having me today.
Yeah, it's great to have you here. And I want to just make sure, Dr. Casellini, I said that correctly, like Casellini.
Yes,
correct?
Perfect.
Awesome. It's so funny when you read it, it's so easy, and then all of a sudden your mind wants to make it more difficult. It's one of those names.
I know, right?
Yeah, so tell us, how'd you get involved in dentistry? I always like to ask that. I always like people to remember why they got involved in dentistry too, right? So how'd you get in?
Well, I guess goes back many, many years. I'm actually fourth generation dental professional on my dad's side of the family. So I guess you'd say I was kind of born to be a dentist, but I actually never really wanted to be a dentist from childhood. I wanted to be a veterinarian, and I ended up going to the University of Vermont and getting my bachelor's in animal science. And when I graduated, I had graduated a semester early, and my parents said, well, if you want to hang out with your friends and stay on campus, you got to get a job. So I was like, okay, well, what can I do? And I had met a wonderful prosthodontist in Burlington, Vermont, while I was in college through some family friends who had been great to me during college and kind of were my substitute family. And he said to me, well, why don't you come and be a dental assistant for me for a while and see if you like it? And so I went and worked as a dental assistant for him, and that's actually what prompted me to going into dentistry. It wasn't my family, it wasn't my parents. He was just such a wonderful mentor and really kind of showed me the joys of dentistry, because both of my parents were dental techs, and so I never really liked the technical part of dentistry. I never wanted to be a dental technician. And so I always said, oh, dentistry is not for me. I want to be a veterinarian. But then once I kind of had more exposure to, actually being in a dental office, as an assistant, I was like, what, actually, I think I like dentistry and I think this is for me. So I ended up deciding to apply to dental school and went to Penn and got my degree in dentistry, and the rest is history.
That's awesome. So you're out on the West Coast now.
Yes. I grew up here in Los Angeles. So after I graduated from dental school, it just seemed natural that I go back to Los Angeles, where my parents had a dental laboratory. And I actually went straight into private practice and opened a practice right next door to my parents' lab. So that was very helpful. And they were such great mentors to me when I was first coming out of dental school and had no idea what I was doing.
Yeah. So I'm guessing that you got a level of service from your lab that only the dentists could just only dream about the most, right?
Yes, I was very spoiled. And, I learned so much from also just the technical point of view, having the lab there, seeing how they were doing my cases and how they were making them, kind of also gave me a different perspective on dentistry. So I really like that. And I think it was very beneficial for my future career.
So let me ask you this question. You're in Los Angeles, and it's obviously a very busy market there. I mean, it's one of the most populated areas in the country, and a lot of people love living there. And so there's a lot of dentists there, right? That's nice areas, or areas that people love to live. There's typically a lot of dentists, right? I'm in Colorado. They're everywhere here, right? You go out into the middle of central Michigan, not so many dentists, right? Tell me, what are some of the challenges that your colleagues, the dentists that you're talking to at events and meetings, what are some of the challenges that you're hearing right now that you can give advice on and that you can speak to?
Well, I mean, in your point, my office is in a medical building, so it's basically, I would say, 90% dentists in my building. So there's probably 30 to 40 dentists just in my building. So, talk about saturated. But I think people really say that marketing and getting your name out there is the hardest thing, because the competition is so great and there are so many dentists and, everyone is kind of competing against each other. So I think that is pretty much like what most people struggle with the most here in Los Angeles. So
Sure. Yeah. So what are some things that in your experiences that you've done in marketing and advertising that have not worked out so well?
that have not worked out. I think it just really depends like who you want to market to. So I think really in the beginning, I think just doing across the board marketing like just wasn't beneficial because it wasn't attracting the kind of clientele and patient base that I was looking for. So I think really trying to figure out like who do you want to walk in the door and then think about like what kind of marketing can I do to attract that kind of patient and really kind of hone in on what your demographic is, where you want your patient base to come from, what socioeconomic, place you want, all those things. I think if you really think about that first and then do your marketing, I think will be more beneficial.
Yeah, that makes sense. Who's your ideal patient? What is it? How did you come about? What was the process and what does that look like? And ultimately, who's your ideal
I mean, I
patient?
think my ideal patient would definitely be like a fee for service patient who doesn't have insurance or has a PPO insurance who is not necessarily looking for their in-network like dentist, that they're more willing to go somewhere that they know is going to be good, not necessarily what their insurance plan will cover. That's definitely, the kind of patients that I'm looking for. Someone who's looking for a more customized experience. So we're like a boutique style office, a very small office. We cater to basically like one patient at a time. So someone who's looking for maybe that VIP experience, but not necessarily needing to go to Beverly Hills and going to like the top dentist who's charging them an arm and a leg. So, I think that that's kind of who my ideal patient would be.
Yeah, I think the patient experience is so important. I think a lot of people think you have to put a lot of money into patient experience, right? What are you going to offer the patient? What is that going to look like? What are some things that you've done in your practice that haven't cost a fortune to really up that level of experience for your patient?
I think the thing that our patients love the most is we give them a lavender scented hot towel after every appointment. It just kind of elevates the experience, makes them relaxed and feel like they just had a spa experience when they were at the dentist. And our patients always say that that's their favorite part of the appointment is getting their hot towel because they know the appointment's over and it's like relaxing and it's nice and it's just like a nice touch that we do at the end of the appointment. And so I think our patients really appreciate that, and it's just a nice touch that doesn't really ultimately cost us a fortune to do.
Yeah. What is it? What is it when you say cost a fortune or it doesn't cost a fortune? What is it per patient? Do you have any idea what it costs you?
Off the top of my
Yeah,
head,
exactly.
I do
Yeah.
not know. I've been doing the hot towels for the past like 10 years, so or more. So honestly, I just like reorder them and I don't even think about what the per patient cost is anymore. But I mean, I could probably speculate somewhere probably like $1 or less. I don't know. I have no idea.
Well, yeah, a little upfront investment, and then it's just a couple bucks. Yeah,
Yes.
it makes sense. I mean, anyone who's flown on the plane and got a little tiny hot, like a washcloth, that's not even scented. It just feels great, right? It makes
Yeah.
you. It adds a ton of value to your experience and it costs next to nothing. That's the reason why they do it, right? Because it adds a lot of value, perception of value. What have you done, Dr. Casellini? What have you done to inspire more referrals from patients in your practice? Have you had any tricks or any tips that you've done over the years that have kind of helped you bring in more patients from your current patient base?
I think ultimately is just treating your patient well and having them have a great experience. I think what's been the most beneficial for me is like right before COVID, I actually ended up letting go like of all my hygienists. This was even before COVID. And I've been doing my own hygiene for quite some time now. And I really built out a relationship with my patients and a rapport with my patients, and having that time during a cleaning where it's very like low stress, easy to have conversations with them. I think I've
Sure.
really built great relationships with my patients, and in turn they have gone and referred to their friends and family because they've actually gotten to know me. Like, I'm not just that dentist who hops in for 5 minutes, looks in their mouth and tells them that they need a crown. I get to spend, 50 minutes with them every 6 months. I get to know their lives. I get to follow up on things that's going on with them. So I think that really has helped me. And that's kind of how I've now shifted my practice to just being like more one-on-one, very like intimate relationships with my patients. And that's really helped me the most.
Yeah. Have you actually seen an increase in case acceptance for when you switch to doing your, yeah.
Absolutely.
Yeah. So I think a lot of times profits can jump up significantly. This is one of those areas I've had guests in the program, and I've talked to a lot of dentists that do their own hygiene and swear by it, and others that tell you, like, you're absolutely insane to do it. Obviously, everybody's different, and how you work is different, and it's not always about dollars and cents, and sometimes it is, and it's okay either way, right? It's about what's right for you and your practice. I think that makes the most amount of sense.
Yeah, absolutely. I think you ultimately need to like have a vision for what you want. And some people's vision is to have like a massive practice with multiple associates and, multiple hygienists and just churn out as many patients as they can. And other people, their vision is to have a more intimate setting. And that's kind of where I've like shifted my goals of my practice is to have just, give my patient the best experience. And in turn, I think they appreciate that.
Yeah, it makes sense to me. Dr. Casellini, thank you so much for coming on and sharing. I'll go back in just a quick second, but the website again, check it out, SwissQualitySmile.com. Check it out. Dr. Casellini, thank you for being here. We appreciate you.
Thank you so much. Thanks for having me.